Hey everybody, welcome back to our Run Smart series. Today we are continuing our conversation on patellofemoral pain. Last time, if you remember, we talked about the definition of patellofemoral pain and what fits under that umbrella, as well as talked about some of the potential causes. So if you missed that video, it's pretty important, so why don't you jump back and find it on our Facebook page or our YouTube channel. But today we're going to start digging into, if we have this condition, what can we do to help improve our pain and improve our function with less pain? So in general, one of the best ways to create a treatment plan is to look at what the causes are for your particular situation and then developing your plan for treatment based on those root causes. We talked about a lot of causes last time, namely in the realms of neuromuscular control and biomechanics, and that is where treatment should really be pointed. When it comes to the earliest phase of this condition, if you have really sharp acute symptoms that are quite debilitating, there's a couple things that have been shown to be really effective. One of them is patellofemoral taping, so different taping techniques that have been shown to reduce pain up to 78% in these early stages. It's not a long-term solution, but if it's something that's really bothering you, even with just walking around your house or doing stairs, taping techniques can be really helpful. The great thing about taping techniques is that there isn't one particular technique that's been shown to be the most helpful, so it can be as easy as going online and looking up different patellofemoral taping, and you can try them out on your own, or you can ask your physical therapist to give you a couple of tips on what types of taping you could do to get you through the early phase of recovery. A couple other techniques for this early phase include electrical or noxious stimulation using a home TENS unit or a stimulation unit that we have here in the clinic, or doing things like ice massage at home on the painfully identified structures. So the taping in these kind of pain modalities can be helpful in that early stage. Now when we get into longer term rehabilitation, where we're thinking about long-term recovery, secondary prevention, meaning we don't want it to come back, or if you're a person who's never had this and you don't want it to come in the first place, there's a couple things that we should consider. The first is as easy as thinking about the muscle length that you have and the muscles surrounding the hip and the knee. If you have a muscle that is too tight, it can lead to abnormal biomechanics. And so having enough length in your hip flexors, your quadriceps, your hamstrings, your calf muscles, because there's a calf that even crosses the knee, and your hip adductors and your gluteal muscles can be huge in allowing your body to go through the appropriate motions. If something's too tight, it might put excess stress on the structures in the knee. What's been found with stretching routines is that anything under 30 seconds isn't really effective in changing the length of the muscle. And so make sure that your muscles are warmed up through a bike or a walk or a short run, and then add in some low load, long duration stretching, meaning that you should have a nice stretch sensation but not pain, and you should hold it for at least 30 seconds, if not up to a minute. So stretching is one easy way that you can have prevention of this condition, as well as helping with your recovery based on what testing might show which muscles are tight. Then we go into the realm of strength. If you have strength deficits, again, that can cause certain abnormal movements when you start to run. So it's really helpful first to have somebody who has a trained, skilled eye and testing abilities to look at the muscles surrounding your hip and your knee. Once your physical therapist or professional has been able to identify these, then starts the process of recovery. Quick note for those of you who don't have this condition, muscles to really focus on when it comes to preventing patellofemoral pain can be the quadriceps, gluteus medius, and gluteus maximus. For people recovering from patellofemoral pain, and we've been able to identify which muscles in you in particular are weak, the next step is to determine, do we need to work on activation, strength, or retraining? So let's walk through those really quick. The first one is activation. So first we have to know, can you even turn the muscle on? We use that here at Point Forward using our surface EMG. If the muscle can't turn on, that's step one. We need to teach the brain and the muscle to connect to one another, and we usually do that through isometric related exercises. So once we can activate, then we can transition into a strengthening regimen. Strengthening is a long process. A good amount of strength doesn't really happen until 6 to 12 weeks of consistent, regular loading and progressive loading through those muscles. And so this is a long phase, but strengthening is a good way to help get the capacity to be able to move well. But we can't just stop there, because research has been showing that no matter how strong or weak a muscle is, it doesn't change the way we move. So they took runners and they looked at their biomechanics. They went through a long period of strengthening. They looked at their biomechanics again, and although they got stronger, the way they moved didn't change. So once you get stronger, then you have to go through a neuromuscular retraining phase. For some people, that's going to be big changes to your running gait, and for some people, it's going to be really small, minor changes. What I like to tell people is that there's a difference between capacity and capability. The strengthening eventually will give you the capacity to move well, but not necessarily the capability. So first we have to build you the capacity through strengthening, and then we have to get you the capability to move well through neuromuscular retraining. The really good news is that there is evidence that shows that neuromuscular retraining with a physical therapist can decrease hip adduction, internal rotation of the hip, and hip drop, all of which we've talked about before contribute to this condition. So if we work on retraining well, you can decrease those excess loads through moving well and having that capability to do it. So here's the take-home message. As we've talked about through these last two videos, patellofemoral pain is largely linked to biomechanical factors, which is really good news because that means that it's very often going to respond to conservative management. However, at the same time, we found that there are a lot of different etiologies or causes, and each person's is going to be slightly different. And so having a team around you to help identify what these causes are can really point your treatment to help you get better as quickly as possible and providing secondary prevention so that it doesn't come back. If you happen to have any more questions regarding patellofemoral pain, please don't be afraid to reach out to us at Point Forward. We would love to answer any additional questions or help you identify which areas within these potential causes you may be experiencing.